Hello, today we are going to discuss about aseptic and antiseptic techniques, and these are mostly used in patient management, on ward, theater, in surgery, and in general these are techniques used by medical professionals and hospital staff to prevent spread of infection from one patient to another, from the patient to the medical personnel, or from the medical personnel and staff to the patients. Our learning outline will define the key terms. We shall discuss about prevention of infection on surgical wounds, prevention of infection on ward and outpatient department, prevention of infection in operating theater, prevention of infection and contamination of surgical instruments, and finally we shall discuss or learn about commonly used antiseptics. Key definitions: we are going to define aseptic technique, and this is the prevention of microbial contamination of tissues and sterile materials by excluding or removing or killing microorganisms. Aseptic technique is anything you do to prevent the spread, to remove or to kill the microorganisms. Disinfections involves the killing or removal of sufficient microbes to render an inanimate object safe for its intended purpose. Disinfection is used only in inanimate objects as long as you're killing microorganisms or rendering them mobile or inactive, and you're doing it on an inanimate object. It is known as disinfection. Antiseptics are chemicals which can be applied to living tissues to kill or inhibit the growth of microbes. So the difference between an antiseptic and a disinfectant is that a disinfectant is used on an inanimate object, while an antiseptic is used on a human being or a living object. Cross-infection is the transfer of microbes in the hospitalized patient to other patients. And autoinfection is the spread of infection from a given colonized area of the body to another part of the body that was not previously colonized. That could be from maybe an infected wound into the systemic saturation, or into any other part of the same body part, same body that was previously not infected. The major cornerstones of decreasing wound infections include gentle tissue handling, that is majorly focused to prevent tissue damage and tissue crashing, especially during surgical procedures, as a damaged tissue will act as a focus of infection post-operatively. Sharp dissection, good hemostasis, and accurate apposition of wound edges without tension. Proper wound debridement, which is vital in post-traumatic wounds to prevent infection. As we are going to see, damaged tissue or dead tissue that is left behind is likely to act as a foci of infection. In general, an ideal antiseptic that is used to prevent or control the spread of infection or growth of microorganisms should have some of the following features. As we had seen, antiseptics are used on human or living tissues, remember. So it should have broad spectrum activity. It should cover the gram-positive, gram-negative, and it should have also cover the microorganisms that have atypical staining. More so, it should be resistant to inactivation by inorganic materials such as blood and feces. It should be of no toxicity and should not initiate an allergic reaction to the body. It should be non-staining and should be cheap. Next, let's discuss about the measures that can be taken to prevent infection spread on surgical wounds. For prevention of infection in surgical wounds, we should be able to identify the sources and routes of infections so that we can know how to control them. The sources of infection in surgical wounds can be the commonest causes of surgical infection the commonest cause of infections on surgical wounds can be the patient himself or herself, the staff, the operation room can also infect a wound, and then even the instruments used can also infect the wound. The patient him or herself can be that and infect his or her wound. The staff, if they use poor techniques, poor surgical technique, poor hand washing procedure, poor scrubbing, they could also spread infection on a surgical wound. Even the operating room, if the operating room is not disinfected, if it's not clean, it could also be a foci of infection, and occasionally even instruments used may spread infection. Commonest routes of infection spread are from person to person, and majorly that is patient to patient, patient staff, or staff to patient. And other routes may also be airborne, that is when it's through inhalation of microorganisms. So how do we prevent infection on ward, or maybe on ward or outpatient department? First of all, on the patient side, common organisms that cause infection in absence of initial infection or like any other infection, common organisms are always skin microorganisms, and they include gram-positive cocci like streptococci, staphylococci, and they're always found on the skin, as we have discussed. Other causes may be gram-negative, such as, and these ones are always such as Pseudomonas, and most of them are always non-resistant, and they are common causes in clean wounds. The gram-negatives are always the common cause of infection in clean wounds. So how do we prevent measures? So how do we prevent infection spread in outpatient departments or on ward? One of them is the measures that can be effective is short hospital stay, preoperatively, shower a day before surgery. Before you're going for surgery, you can prevent infection, maybe surgical wound infection, by showering before surgery, and then treatment of any infectious site before surgery. Aseptic methods with sterile equipment for all procedures, then special preparations, e.g. body preparation for colon surgery. All these measures can help in reduce the rate of infection spread on outpatient department and surgical ward. The staff can also undertake some preventative measures to prevent infection spread, that is through skin disinfection between contact with patients or by detergent and soap, through hand washing in short. In other words, in the wards or outpatient department, the staff can also use antiseptics in intensive care and in neonatal units or even on ward. And then treatment for identified carriers and full-blown cases, e.g. in boils, can also be effective in prevention of infection spread. Here we are a brief highlight on the 5 moments of hand washing. These are recommended by the World Health Organization, and the first moment is the physician, medical personnel, or doctor should wash his or her hands before touching the patient. That's the first moment of hand washing. The second moment of hand washing is before a aseptic procedure or a cleaning procedure. The third moment of hand washing is after exposure, the body fluid or any excretion from the patient. And the fourth stage of hand washing is after touching the patient. Before you leave the patient, you have to wash your hands. And then the fifth stage of hand washing is after touching the patient's surroundings. That can be beddings. You have to wash your hands. So all those moments should be observed by the hospital staff in order to reduce on the rate of infection spread. So how do we prevent infection spread in the operation room? The staff can prevent infection spread through wearing clean clothes, shoes or covers, masks, and head caps or surgical head caps, and this should be put on beyond the green line before you enter the theater, or before you enter the green line of the theater. The staff should be dressed appropriately in above mentioned attire. Scrubbing up of all operating team before each operation for at least 5 minutes with an antiseptic soap or detergent is recommended. And to prevent skin infection, brushes should be used only to clean nails in order to prevent skin damage, so not skin infection. We are preventing skin damage or injury. You would rather use a brush when you're cleaning the nails. Finally, dry with sterile towel and apply 70% alcohol or pivodine iodine if possible. After washing your hands, you should dry them with sterile towel, and then you apply alcohol or pivodine iodine if they are available, and then you put on sterile gloves and gowns in aseptic technique. We shall discuss in the slides in the presentations to come on how to put on gloves using aseptic technique. Then how do we prevent infection spread in the theater on the patient's side? What does the patient do to prevent infection spread? First of all, we should clean the operation field with antiseptic containing chlorhexidine and 2.5% iodine for adults, 70% alcohol for children, and pivodine iodine for all ages if available. So in short, the operating room should be cleaned thoroughly with a disinfectant, and even when you're going to operate, the operating area or the operating field on the skin or on the surface of the patient should be cleaned with an antiseptic, as we have discussed, chlorhexidine with iodine for adults, alcohol 70% for children, and pivodine iodine for all ages if available. And it is also advisable not to shave hair on the patient, as this could pose a risk for infection spread. So, and then after, the patient should be covered with sterile drapes, and the area that is needed for the operation or the operation field should only be left exposed, and then the rest of the patient should be covered with a sterile drape. In the operating room, there are always a few microorganisms, and most of times, if there is proper air conditioning and ventilation, these microorganisms are always blown away. However, there could be risk of spread of infections in the operating room, secondary from the staff. The staff could be from the airborne infections from the staff. There could be spread of infection. That's why it is advisable to put on a face mask to prevent spread of infection. And in addition to that measure, the hospital personnel or the staff that is in the operating theater should be kept to a minimum number, so that to reduce the risk of infection spread, and unnecessary movement should also be discouraged in the operating theater so that infection spread can be reduced. Then the doors should be kept closed as needed for passage of equipment only, not keeping them open to increase the risk of infection. And before operations, you should clean the treatment room, the operating room, and after the operation, you should clean the operating room prior to another operation starting. And majorly, theater rooms are always cleaned using disinfectant. So before any other operation, the theater should be cleaned with the disinfectant, and even the operating machines such as the anesthetic machine, they should also be cleaned and self-checked to rule out the risk of infection. Now we are going to discuss more about how infection spread can be prevented and how contamination of surgical instruments can be prevented. All instruments and garments to be used in surgical procedures must be sterile, and this is attained by sterilization. And sterilization, remember, kills microorganisms, and even it also kills spores. So sterilization is the gold standard for cleaning and decontaminating surgical instruments and theater attires or clothes. And The preferred mode of sterilization is autoclaving, whereby the instruments and clothes are heated up using steam at pressure of 750 millimeters of mercury and above the atmospheric pressure at a temperature of 120 degrees Celsius for 15 to 30 minutes. So sterilization, remember, autoclaving has ability to kill spores and microorganisms. So it is the preferred mode of sterilization for surgical instruments. Dry heat could be an alternative, but does not kill spores, and so it's not reliable as such. So finally, we are going to discuss more about commonly used antiseptics and their unique properties. Our first one is chlorhexidine, which has a good activity against Staphylococcus and Streptococci, and it has moderate activity against gram-negative bacteria. It is expensive and non-toxic, and it has an unpleasant taste. Our next antiseptic is iodine. It has broad spectrum activity. It is cheap. It stains. It is hypersensitive, and it may trigger hypersensitivity reactions. Pivodine iodine, it is also broad spectrum. It's moderately expensive, and it is rapidly inactivated by blood. So where there is bleeding, pivodine iodine may be less effective in controlling infection spread. Then hexachlorophene is slow, but has effect against staph and streptococci. It has systemic toxicity effects for neonates and is slightly expensive. We have also triclosan, which also acts as hexachlorophene, but it is less toxic compared to hexachlorophene. Chlorine is a broad spectrum, though it is locally toxic and expensive. And another antiseptic is dilute sodium hypochlorite solution, which is a broad spectrum also. It is cheap, but is also locally toxic. Then we also have quaternary ammonium compounds such as cetrimide or in benzachromium chloride. And these ones have poor gram-negativity activity, and they are readily contaminated detergent, and it is cheap, and they are also non-toxic. Then there is noxethiolin, for it releases formaldehyde in contact with tissues. It is broad spectrum, it is expensive, it is weak, and slowly bactericidal. From discussion, the most useful that I always used antiseptic mixtures, that is alcohol combined with chlorhexidine, or alcohol combined with pivodine iodine, and alcohol combined with cetrimide. So quaternary ammonium compounds such as cetrimide in benzyl chloride can also be used. More so, we should remember that other antiseptics such as formaldehyde, glutaldehyde are also effective in disinfection, and especially they are also used in conservation or preservation of samples, and they are also used in preservation of samples as they are being prepared for further studies. I hope this presentation will be effective for both of us. I wish you good luck until we meet again. Thank you.